Avenues is home. It's the community, it's the staff, it's the therapists, it's our medical team, it's our behavioral health technicians, and it's our alumni. Avenues is the way to finding lasting peace, serenity, and the substance within you. If someone were to ask me who is Avenues, I would say, I am Avenues. You are Avenues. We are Avenues.
Extended care is long-term treatment that allows clients the opportunity to transition from inpatient into the real world. The benefits of extended care is feeling safe and supported while still being able to engage within society and move forward. This level of care offers you the opportunity to face those challenges while having support from our staff.
My name is Tracy McCarthy, and I'm the Clinical Director of Avenues Extended Care in Concord, New Hampshire. The benefit of extended care from a brain perspective, to get to a point where you've become addicted to a substance, your brain has actually been damaged. In order to recover from a progressive disease, you need a progressive approach to recovery. And your brain needs time to be able to readapt, to form new connections so that those neurochemicals and those neurotransmitters are able to flow throughout the nervous system and throughout your limbic system.
It's the best possible approach, I believe, to be able to stay in a program that's 6 months long, to develop like a rapport within the community and develop positive peer relationships, healthy confrontation. Statistics show that like 85% of people relapse within their first year, and even in their first 2-3 weeks, if they're not following through with another level of structure, the chances are not so great.
I went through probably about 9 different treatments and 1 PHP before this. I kept on relapsing, couldn't stop. No treatments were really helping me. I ended up staying for about 8 months. It was actually a really good experience, a lot more than I thought. It gave me a lot more support than just the regular 30-day kind of programs.
If it wasn't for Bucks, I don't know what I'd be doing. I most likely would be dead or in prison, 100%. My parents didn't trust me. Family didn't trust me, no one trusted me. All I did was steal and lie from them. And them being involved in my actual treatment really helped. They're coming over literally today to come see their granddaughters. And that's amazing to me. Oh, I'm gonna cry. I know how to treat them the right way today because of Avenues. This is Uncle Tyler. He was the first friend to come see my baby. My 7-year-old calls him Uncle Tyler.
Me and him really connected through the whole process. So it really gave me the push, like, hey, I can do this too. So I came back after I relapsed, and this time I, followed the same thing Drew did. Got out, now I'm at 21 months clean, thanks to Avenues. My name's Tyler.
My name's Drew.
And we found our way home, and you can too.
As a collective, we're able to reach a lot of people. I know we have helped a lot of people. It's just what we do. Once a client completes PHP portion of our program, we have partnered with some businesses in the area that, give our clients opportunities for employment. We have a former client who has maintained his sobriety and has opened a cafe in the area, and he is very keen on giving clients an opportunity at his place of business. I know wholeheartedly that this is real and it works.
The goal is to get people to win their lives back. Addiction is a very complex disease. Diseases like depression, post-traumatic stress disorder, anxiety disorders, bipolar disorders. Many times after we start talking to clients, we find that they are actually trying to manage these diseases on their own without the appropriate supports. One of the things that makes Avenues unique, or our extended care program, is the fact that not only will you have access to therapists, you'll be involved in groups, but you'll also have access to a provider. It allows you to focus in on what matters to you in your recovery and gives you the best opportunity to reach the recovery that you deserve.
I knew about the alcohol part of sobriety, removing alcohol, but I didn't realize that there were all these other things that would help me really stay sober and also improve my quality of life. The staff here, the counselors, the admin people, the behavioral health techs, they really just like scoop you up and carry you along. They build you up and they meet you where you're at, and it's definitely more of a family vibe than like a treatment type of vibe. And that's really what got me to like understand that if I stayed here, I had the best chance at staying sober.
If I could describe the community in one word, I would say it was fun. It was actually a really good time. Everybody be laughing, smiling, joking, jovial.
The reason I would use the word passion to describe Avenues is because the people here genuinely care. They're going to go out of their way to do whatever they can to help you. They're going to make sure no matter how you're feeling, what you're going through, that you have the support that you need in order to be successful.
It's very safe, secure. Everyone's here to support one another.
I just felt like I was a part of the group right away. Like definitely welcoming, made me feel comfortable.
Upon coming in on your first day at Avenues, you're going to be met with staff that's going to take you through the facility. They're going to give you a tour. The staff as well as the clients are going to help you make your bed and put your clothes away. Make sure that you know that they're there to help you and that they're going to do anything they can to get you through it.
The truth is, I cried. That first day I got there, I cried all day. Now all of a sudden I'm living in a house with girls that were younger than me. It was bizarre. The relationships I formed in recovery were beyond measure. It's just been amazing. It's just an amazing friendship. Amazing friendships that have been formed due to me being in recovery. And I have lifelong friends now. It rehabilitated me as a person because I felt that what it really all boiled down to is working on myself. I have gained confidence in my life that I haven't had for a very, very long time, all due to the fact that I followed through on the whole treatment plan with Avenues for the 4 months, from in-house recovery to extended care.
Recovery fits into my story mainly because it's something that I've struggled with in my life. So doing the work I do in admissions, I know how it feels to be on the other end of that phone call, reaching out, asking for help, and it feels good being able to be that person for people when they call and looking for that help. I believe really in the extended care, IOP, outpatient level of care. I think that's the most work that a client can do while in substance abuse treatment. It's really where the rubber hits the road. They leave after 30 to 45 days of residential and they're left with all these feelings and not much of a support system. So going from that intense 24/7 residential experience to like an outpatient level of care, it adds that extra level of security. The longer that you're in some sort of program, whether it be inpatient, detox, residential, extended care especially, the longer amount of time that you can spend in those services, you grow your chances exponentially of staying sober long term, multiple years. My name is Dan. I found my way home.
My name is Nick. I found my way home.
My name is Tree. I found my way home.
I'm Fiona. I found my way home.
My name is Eric, and I found my way home.
My name is Stacy, and I found my way home at Avenues.
You can find your way home too.